Welcome to the morning. Oh, my coffee. Where's my coffee? Hi. Good morning. How are you? I can't remember it. Hey, pretty lady. Hey, G. Good morning, G. Where are you from, G? Bruno Pereira. Good morning. Hello. I'm from Aruba Island. Oh, Aruba. Bruno Pereira, English lang po. BBC Winter, good morning. Gabriel Montero. Hello. Belobay from Pakistan. Good morning, good evening, everyone. Ooh. How are you guys? How are you guys? How are you guys? How are you guys? That's fine. I'm good. Coffee, guys, coffee. Hello to my viewers. Good morning. Oh, sorry. No. Good morning. Hello to my one viewer. Good morning. What are some reasons why infants cry? When the infants are wet, hungry, and comfortable. What will you do if your child has temperature tension? Stay calm, don't be argue, and provide safety. What safety precaution should you? What safety precaution should to be observed when toddlers is in the crib? raise the side wheels of the crib and lock it securely. Why should toddlers be allowed to walk the surrounding? To satisfy toddlers' curiosity and sensory development. How would you enhance toddlers' physical growth how would you enhance toddlers' physical growth and development? Provide a boat show. Provide a boat show, allow them to ride a bicycle, let them run around, and run the streets with supervision. Bello! Bello, bye! If you study, so why you go LLB? Because I want to, ano? What safety precaution are you going to do when infant starts growing? Keep the surrounding clean, free from sharp objects. No small object that can suffocate the child. To the child, and avoid plastic that may swallow to the child. No small object that can swallow the child, and and avoid plastic that can suffocate the child. What will you do if the toddlers have convulsions due to high fever? Provide TSB, call emergency hotline and bring to the nearest hospital and notify the parents. How would you know if the child is ready to be toilet trained? When the baby shows their bowel control, when the baby shows their sign of bowel control, Beluba. fall, fall, fall in love. Where are you from, Belubay? Hello to my two viewers. Good morning. How are you guys? I hope you're already feeling good. How will you know if the child is ready to be children? When the baby when the child when the child feels are good to defecate or urinate, and when the baby show a sign when the baby show a sign for bowel control. What will you do if the child wet the bathroom or comfortable accidentally? Rescue the child, clean the child gently, and do not leave the child unattended. What are the things to be considered in dressing up the child? The child age, sex, preference, and likes, and weather condition, cultural background, and what precaution would you to take avoid while child is playing with the toys? Check the toys before you're giving it to the children. Make sure there are no broken pieces or sharp edges of the toys, and ensure there are no scattered toys around the walkways or in the stairs. What precaution would you to take avoid while the child starts scrolling? I from your heart. Oh, really? Are you sure for that? Please click the dollar sign, guys. Good morning, good morning, good morning, everyone. Make check first. Check first the toys. Check first the toys before you giving it to the child. Then make sure the toys are is not broke. Make sure the toys are no broken pieces and sharp edges of the toys, and ensure the toys were not scattered around the walkways. Oh, thank you. Hello to my 5 viewers. Please click the dollar sign. Belubay. Belubay, where are you from? Ah, from Pakistan. Coffee, coffee, coffee time. I can't remember in my life that you know. How old are you, baby boy? Ma, I miss my question. What action should you avoid while feeding first schoolers? Serve plain food. Serve plain food. Avoid nagging. Avoid bribery, and avoid rewarding. What are the precautions in preparing meal for asthmatic child? Be aware the food to which the child allergies allergic. Be aware of the food in which the child are allergic, and avoid serving of substitute that are non-allergic. Be aware of the food that will allergic of the child, and provide food that hypoallergic food. uh, be aware of the food that you will serve to the child. And what will you do if the child swallow food at chemical agent? Offer milk, dilute water immediately. Keep the bottle content. Keep the bottle poison. Bring to the nearest hospital and inform the parents. What will you do if the child has born? Immerse in affected area in a cold water and bring to the near and inform the parents. Or check the degree of burn in the first degree. Um, apply clean cold water. In the second degree, apply immerse clean cold water, but do not break the blister. Call emergency hotline. Ano ba to? I shattered the world, shining darkness, spending, overwhelming, commanding, thumbing. A soak in a clean cold water, second cold water, but do not break the blister. Wrap closely with cotton fabric. Bring to the nearest hospital. And the third degree, prepare emergency radio management shock. Monitor the vital signs and keep patients warm while waiting. No. Lesson. Lesson. What will you do? What will you do the child? What will you do if the child was born? In the first degree, apply clean cold water. Second degree, apply soft clean cold water, but do not break the blister. And closely, up, wrap wrap closely in a cotton fabric, and call emergency hotline, and monitor the vital signs and inform the parents and inform the parents. What will you do in case fire at home? Okay, I'm going. What happened to you, Bali Bully? Bali Bully? Why you sad? My coffee. Why you sad? Manong sad man na, baby na? Manong sad man na, baby na? I can't remember. Hello to my 5 viewers. Good morning. How are you guys? I hope you're feeling better today. What will you do in case fire at home? Get the child out of the house in a safe place. Ask neighbor help. Call fire department. And prioritize the safety and comfort of the child. What are the activities that enhance intellectual creative needs of a child? By engaging storytelling, painting, and drawing. How would you boost child self-esteem? Allow the child to express their allow the child to express their feelings and ideas. Allow them to do a simple task. Allow the child to express their feelings and idea, and allow them to do a simple task. Give them a lot of praise and acknowledge and appreciate their positive behavior. How would you boost the child's self-esteem? How would you boost the child's self-esteem? How would you boost the child's self-esteem? Allow the child to express their feelings and ideas. Allow the child to do a simple task. Give them a lot of praise and acknowledge and appreciate their positive behavior. How would you develop bond with a child? By giving time to talk and playing, and allowing the child to participate chorus together. And what are the best outdoor activities for 8 to 10 years old? Organize football such as basketball and volleyball. What indoor activities that enhance motor skills? Dance and gymnastics, uh, dance and gymnastic, playing and playing and ball games, outdoor, enhance motor skills, what in the gymnastic and dance, running, walking, climbing. What are the hygienic practices that you instill in the children? Hand washing before and after eating, bathing, toothbrushing, changes of brush clothes every day, good grooming, care of the nail and hair. What is the importance of back rub and bedridden clients? To promote blood circulation, to stimulate blood circulation, and to promote relaxation and to prevent blisters. To stimulate blood circulation, to promote comfort and relaxation, and to prevent blisters. What are the basic considerations assisting a client of their personal life? Maintain client privacy, safety, privacy, comfort, and dignity. Oh, why you sad? Good morning, good morning, good morning. How you help? How could you help the client maintain self-esteem and self-independence? For self-esteem, appreciate and acknowledge their cooperation, and for self-independence, encourage the patient's cooperation if the patient is able, challenging them to do as well. Challenging them to do as soon as possible. What important safety precaution must be done when transferring client from bed to wheelchair? Lock the wheels of the bed in the wheelchair. Lock the wheels of the bed in the wheelchair and observe proper body mechanics. Nganong bastos mo na, baby na? Wala na, buod na. What are some physical changes related to aging? Reflexes are slow, loss of skin elasticity. Underlying fat becomes thick and fragile. Sense becomes less accurate and walking becomes difficult. Walking becomes difficult due to loss of muscle strength. The reflexes are slow, loss of skin elasticity, hair loses color, underlying fat becomes fragile, sense less accurate, and difficulties of walking due to loss of muscle strength. What is the basic role in care of client with Alzheimer's disease? Supervise closely but do not restrain the client. Orient the client and be a good listener. Be patient and introduce yourself again and again. Ouch. Good morning, Ghost. Thank you for... Good morning, how are you doing? I'm studying, Ghost, because my exam will starting on Thursday. So my last day to it's my last day to survive. I'm so busy for my for my future goals. A lot of review. Yeah. My final exam is coming. That's why it's working, studying more for the Q&A, question and answer portion, and also the demonstration of 17th procedure, like the CPR for adult and child, CPR for adult and child, and rescue breathing, choking management, and bed baiting, bed making, and splanting, one care, formula making, baby bathing, burping techniques, hand washing, uh, small dressing up with the child, bathing with the child, bed mobilization, transferring when a client from bed to wheelchair, and catheter care, perineal care, sheathing procedure, and that's it. Why kalibangon mo na bibin na? Naman ko, uy. I wish Sanders. I will trying my best to pass and trust of myself. Nabuang aha naman ko. What are the most effective ways to control spreading of virus? By proper hand washing. How would you know if the bottle content is poisonous? If there is skull symbol on close long bone, check this changes of color and check the expiry date. What protective device can be used for infection control? A PPE like gloves, masks, gowns, lab gowns, boots, goggles, cap, or hair net. What are the common signs when a client has impending heart attack? A persistent chest pain or persistent chest pain, pressure, trouble of breathing, persistent chest pain, persistent chest pain, trouble irregular breathing, or persistent chest pain not relieved by medication and irregular of breathing. Hello to my 4 viewers. Good morning, guys. What is the common signs of infection? Fever, febrile, or hyperthermia. What will you do your client has a blood pressure over 150 over 100? Put the client in a comfortable position. Check the blood pressure every 10 to 15 minutes, and if the BP is still high, seek a medical assistance, call an ambulance, and bring to the nearest hospital. How would you respond to your cancer client as the statement, "I wish I could die"? Allow the client to ventilize their feelings. Um, uh, 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 Provide therapeutic communication and allow the client to ventilize their feelings. Be a good listener and have an open-ended question, and provide comfort to the client. How would you react with criticized colleagues at the workplace? Ignore them and do your job well. What will you do if you found out the client affected Alzheimer's disease scattered stool in the room? Stay calm. Uh, Stay calm. Clean and sanitize the client and the room, and orient the client. What are the recommended diets for elderly client? Low fat, low sodium, and regular diet. What is the most important consideration when preparing meals for your diabetic client? The sugar content of the food, or calorie required of a client. The sugar content of the sugar content co- the sugar content of food. Limit the sugar content of the food, and also low fats, low sodium, and also regular diet. What are the common signs when a client has a low blood pressure? Changes of level consciousness such as dizziness, sweating, tremors, drowsiness, and confusion and irregular breathing, and abnormal pulse, feeling or looking pale skin, blurry eyesight, sweating, and confusion. Hello to my three viewers. Good morning, good morning, good morning, good morning. I hope you are. What are the safety precautions to be observed in caring for a client with diminished vision? Provide adequate lighting, uh, and arrange all personal needs orderly. What is the first thing to do before vacuuming a carpet? Remove small object around the carpet. Check the potency of the vacuum cleaner. Check the va- check the check the potency check the potency of vacuum cleaner and clean the machine. How would you tell if the walls are washable? If the walls is washable. And once the washable is washable. If the walls are washable, it's the washable. If the washable. If we wash, 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 if we if we wash, if we Hi there, what's happening? Anything good? Yes. Yes, Paul Matsin, good morning, good morning. I'm studying, Paul. Ano? Wait, guys. I'm supposed to go. Morning, guys. I'm back. Yes, Paul. I'm done defecating. Oh, Lord. I could shut out the world, shining there in the spin of fire. I don't know how would you test if the walls is washable. How would you test if the walls is washable? How would you know if the walls is washable? Do TSB if do TSB, and if will not subside, bring to the nearest hospital. Call emergency hotline and bring to the nearest hospital. I'm today. Where is today? Where is? If you're happy and you know, stop your hands. If you're happy and you know, if you're happy and you know, if you're happy and you know, why not wrong? Happy and you know, we never know. If you're naman naman and you know, why not? Man to oy. Ito nga siya ba? It is not washable. I don't know washable. Sakto sponge. If the walls, if the cover, if the color covers, if the color covers, if the color covers of the wall, how would you test if the walls are washable? With Sackley sponge, and if the walls is absorb water. How would you control household pets like mosquitoes, cockroach around, and flies? Dispose garbage or waste regular with dispose garbage in a proper segregation. Maintain cleanliness at all time, and use pest control agent that less of toxic to humans. Yes, and the disinfectant in vivo. What are the basic stretches used to mend seams, box stitch, and running stitch? How would you remove ketchup or tomato stains from a fabric? Scrape or remove the tomato sauce. Scrape or remove the excess of tomato sauce as possible. Run cold water at the back of the stain. Rub liquid detergent at the rub liquid detergent into the stain area, and if the stain still if the stain still remain if the still remain, uh, rub detergent rub detergent and bleach stay in and rub again rub chlorine bleach stay in 30 minutes stay in rub if the stain still remain, apply chlorine bleach soak in warm water stay in 30 minutes and rinse well until the stain is completely removed. uh, how do prevent cloth wrinkage when using machine dryer? Check the curl level of machine dryer. Check the curl level of fabrics. Check the curl level of the fabric. Use lower heat settings of machine dryer and remove clothing while slightly damp. How do you describe color fast and non-color fast? Color fast does not bleed and non-color fast does bleed. That does bleed. What should you do to have smooth easy ironing? Use fabric while washing. Use fabric while washing and use fabric while washing. Easy ironing. Should you do have smooth easy ironing? Use fabric while washing and use fabric while washing and use water spray while ironing. What are the advantages of fabric conditioner? Can remove static cling. To avoid static cling of clothing and to maintain and makes the fabric smooth and good smell and smells good. What are the basic steps in maintenance of machine dryer? Clean and dry the lint filter of machine dryer. Clean and dry the lint filter of machine dryer. How would you prevent full slips in the bathroom? Provide a well-lit bathroom. Keep the bathroom dry. Keep the bathroom floor dry in all times and place the non-slip mats and install grab bars or reels around the bathroom, the toilet, or in the shower. I can open your eyes. It's difference here. Hey, Maria! Hello to my one viewers. Good morning, everyone. What are the importance of brow club to avoid reading crying? To promote blood circulation, to promote relaxation and comfort, and to prevent blisters. What are the basic considerations assisting clients with his personal needs. Consider patients, safety, privacy, comfort, and dignity. Tasty Sanders, Tasty, Tatay Sanders, good morning. Where are you from, Tatay? Hello, everyone. Tatay Sanders. Lazada. Dali na po tabi. Let's focus in the other. Let's proceed to the other. Ano? Let's focus. Let's ano for the ano. Bed making is a technique in preparing in different types of bed, making patient comfortable on his or her particular condition. So the purpose of bed making is to promote neat and clean environment, to provide smooth, wrinkle and prevent foundation, thus minimizing the skin irritation, and to maintain health status. To maintain health status. Bed baiting is a refreshing activity that's given to an individual. Houston, Texas. Oh, from Texas. Good evening. How are you? Bed baiting is a refreshing activity that given an individual who is confined to bed or a patient who cannot safely to get out their bed. Purpose: to remove transient microorganisms, body secretions, and dead skin cells, and to stimulate circulation of the skin, to provide comfort to the patient, to promote patient comfort and relaxation, and to produce sense of well-being, a way to communicate the patient, a way to participate the patient. Hello, Tatay. Shaving procedure. So shaving is a procedure in removing a facial hair such as beard, mustache of a male patient who cannot do shaving by who cannot manage to do shaving by himself. So the purpose is to maintain skin integrity, to provide good appearance, to promote hygiene, and to produce sense of well-being. Perineal is a cleansing procedure that prescribed of perineum. It is washing the genitals or an anal area. So the purpose is to remove perineal secretions and odors, to make the patient fresh and comfortable, to maintain proper hygiene, and to promote healing. So bed mobilization is a transfer can be viewed as a safe can be viewed as the safe movement of a person from one place to another. So the purpose is to prevent complications of mobility such as joint stiffness, such as atrophy, joint stiffness, pneumonia, muscle contracture, and bed sores. Ambulating is simply assisting of a client by walking her own, who is walking by her own. And there are types of ambulating. We have minimal and maximal. So for minimal, if the caregiver is taller than the client, place the arm of the patient at the shoulder of the caregiver. If the client is taller than the caregiver, place the arm of the client at the shoulder of the caregiver. Catheter care is a procedure to clean and to keep the catheter from bacteria. And catheter is a flexible plastic tube that is used to drain a urine from bladder to a patient who cannot urinate by himself. So the purpose is to avoid ascending infection. In formula making, if a Nestle product is if the milk is not Nestle product, 1:1. So if the baby is 5 months, and then add 2 ounces of water, and then so it is 7 ounces of water. So if 1:1, if the 7 ounces of water, 7 ounces of powdered milk. If the non-Nestle milk, 1:2. For example, if your baby is 7 months, add 2 ounces of water, so 7, 8. So equivalent of 9 ounces of water. So 9 ounces of water. So with 9 ounces of water, so the powdered milk is 4.5 scoop of powdered milk. So that is the non-Nestle one. So for bed positioning of a patient in bed is a common procedure in which determine the patient's condition. Bed positioning is a positioning of the patient's the baby. what you know. And then a hair comes along when it comes to carry on. And the touch you know. And then now you can survive. So when I'm feeling unknown, you can find where you know, and you catch me never slow. And I hear a can so long. So, great assessors. So, good morning, assessors. I am Ezaros Cordova, student from Megamich Training Center Incorporated. So, this afternoon, I will be performing a bed positioning. So, bed positioning is a common procedure in which determine the patient's condition, preference, and trait-related illnesses. Bed positioning is a common procedure in which determine the patient's conditions, preference, and illnesses. Bed positioning is a common procedure for a patient to know is a common procedure in which determine the patient's condition, preference, and illnesses. So purpose for bed positioning is proper positioning is a vital providing comfort of the patient who are not bedridden or have different clinical guidelines. Support device. So supine between the patient's lies of flat back. The purpose is good for visible healing after surgery. Lateral position. So this is the lateral position. Let's see. So lateral position is the patient lies of the top legs is over the bottom leg. The top leg is over the bottom legs. Is good for pregnant women within 7 to 9 months of pregnant. It is good for a pregnant woman within 7 to 9 months. Supine is good for healing after surgery. Lateral is the the top legs is over the bottom leg, and it is good for proper back alignment and good for a pregnant woman within 7 to 9 months of pregnancy. And then the Sims position, something like that. Sims position is the patient lies between supine and prone with flex and prone. The patient lies between supine and prone position. It is good for rectal examination and good for pregnant women within 1 and second. It is good for a woman within 6 months pregnancy. And then prone position is nakakulog. Prone position lies on stomach with a turn of the side. When the patient lies on the stomach and the head turns to the side, it is good for oral drainage and good for sleeping. Hi everyone! So supine nakaanak. It is good for healing after surgery. And lateral position is good for 7 to 9 months pregnancy. Sims position, the patient lies between prone and between supine and prone. It is good for 6 months pregnancy. Ang prone position is a patient's lies stomach and the head torn to the side. It is good for oral drainage and good for sleeping. Ang Fowler's position as the patient's head of bed is placed at the 45 degree angle. The patient's of the head is 45 degrees angle, the Fowler's position. And the semi-Fowler's position and the patient's head placed in the 30 degrees. And Fowler's position, naka-elevate the head of the bed is placed of 45 degrees, and semi-Fowler's position, the head of the bed is placed of 30 degrees. Ang semi. Ang dorsal recumbent position is good for vaginal examination and childbirth. And the lithotomy is the common position for surgical use. This is the use for surgical. And dorsal recumbent is good for rectal examination or vaginal examination or catheter urinary bladder. Ang lithotomy is good is a position for a childbirth is the legs flexed of 90 degrees. Legs flexed of 90 degrees. Ang orthopnec is good for proper healing. It's good for a patient who has respiratory problem. Orthopnec. A niche's position in used for anus or used for anus or rectal examination. Niches. A supine position, lateral position, Sims position, prone position, Fowler's position, the head of the patient, the head of bed placed in the 45 degrees, and for the semi-Fowler's position, the head patient is the Fowler's position is the head of the bed is placed in the 45 degrees. It is good for having injected feeding. And semi-Fowler's position, the head of the bed is 30 degrees angle, and is good for is good for a patient who have esophageal tube, and also the patient who have cardiovascular and respiratory condition. Dorsal recumbent position is good for the catheter position or catheter of urinary bladder. And ang lithotomy, it's good for childbirth. And then the orthopney, it's good for the proper it's good for respiratory problems like asthma or anything. The niche's position is good for rectal examination. What's up, guys? Tatay Sanders! I'm so tired, guys! Oh my god. If you're happy and you know it, clap your hands. If your ex is like you know it, clap your hands. time, guys. If you know, I know. I'm so tired for everything. And I know, just know. Na, 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 na. Bye everyone. See you next time. Hello. Bye bye bye. And I know, just know. See you next time, guys. Thank you for joining my live. Kita kits next time. Bye bye.